I'm Dr. Terry Hughes. I'm a family physician, and I'm with Froedtert and the Medical College of Wisconsin. I received my education at the Des Moines College of Osteopathic Medicine and Surgery in Des Moines, Iowa. Back in 1979 I graduated, and then I went on to do my postgraduate training at Flint Osteopathic Hospital in Flint, Michigan. And then after that, I moved here to Milwaukee to start a private family practice. I've been in practice for 34 years now, and so I have patients of all ages. Some of them I met when they were very young, and they're still with me, and some of those now are well into their 90s, 80s and 90s, and then I have plenty of patients along the way from cradle to grave, as we say in family practice. So we have patients of all ages, and so do I. In family practice, along the way, we see so many different problems and different conditions that you do sort of end up tending toward some areas of interest, and I think in that regard I've done a lot of sports medicine through the years. I'm an active sports participant, so that kind of led to a lot of interest in that regard. And we do a lot of weight loss medicine, which has become a very important part of medicine in general. And I think other than that, I would just say generally family medicine and all that encompasses. Through the years of family practice, I've gotten to, you develop a style, and I think my style has been really based on being informal, to start with patients, try to get to know them as friends so that I can get to know them as what their life is like, what their family and work life is like. I mean, that's the most important thing for many medical conditions, to know where is this patient coming from in terms of what can they do in their life to change whatever they have to do to be healthy or to get better with medical conditions. So I think that's a basic foundation of how I approach patients. I think the second thing that is something that has developed over the past years is that every patient nowadays needs an advocate for them. I mean, when it comes to getting in the hospital, when it comes to getting to see the right specialist, to getting medicines filled at the pharmacy, whatever. I mean, you need an advocate to do that. You can't do it on your own, and that has become our job as family physicians. I chose family medicine really because early on in a doctor's training, you get excited about whatever specialty you might be working in. And so, for instance, when you're doing surgery, you get excited about surgery. When you're doing pulmonary medicine, you get excited about pulmonary medicine. I think it's sort of my personality that I like to learn, and I got excited about each of these areas. And when it came down to the deciding time, I think it was only right that I would actually specialize in an area that encompasses all of those specialties, and that's family medicine. So it's a perfect fit for me. Outside of the office, I'm married to my wife of over 40 years. We are happy to have 3 adult children who are married and have grandchildren with them. We enjoy that very much. I play golf and tennis regularly. I'm interested in reading subjects of all type, and I'm interested in following our local sports teams regularly, and so I'm able to stay pretty busy outside of the office.